Hi everybody, my name is Sky, and today I am 1 year post-op from top surgery. Now, instead of going straight into showing off my chest and talking about it, I thought I would address things of a more serious matter. Basically, I'm going to talk about my recovery and give a little advice to people out there that might want to have top surgery. Now, since I'm going to be talking about a surgical procedure, I'm going to be mentioning body parts and body functioning, and some of that might upset people. So if you do get upset over stuff like that, please leave the video now. Okay, I think everyone's gone. Let me move on. I would say that top surgery is not a decision to be made in haste, and it is not always easy to recover from. I wish someone had told me that when I had top surgery. Instead, I heard stories like people were saying they were satisfied with the results, they didn't have a lot of pain, they felt that their minds and their bodies were aligned, they felt happier, and that wasn't the case with me. Not only was I in more pain than I expected, but I wasn't nearly as happy as I expected to be. When I woke up from the procedure, I was in so much pain that I felt like screaming. The nurses told me to just relax and breathe, and I did that. And, I spent 6 hours on the operating table, I think, about 6 hours. And I spent that long on the operating table because there was a complication. The surgeon was having a tough time reattaching my nipple to my chest. This was the left nipple. So he had to completely change the procedure he was going to do altogether and do a different procedure that made it possible for my nipple to stay attached. That's why it took so darn long. But it kind of worked out in my favor because the scars aren't like those swooping under the nipple scars that I hate. I hate those the kind of scars because it looks like the shadow of a boob. So at least I don't have that. But, I did have complications and lots of pain. Anywho, I spent 3 days in the hospital. Not just because of that complication, but because they were having a tough time finding a good medication to manage my pain, and because my body forgot how to urinate. Yeah, it's weird, but this has happened to me before when I had a surgery. It's like my body forgot how to do certain things because it was in shock due to just being operated on. So for the first day after top surgery, I could not pee. And also with the hysterectomy, I couldn't pee for 2 days. So you know what that means. Yeah, I had to be catheterized. We all know how fun that is, right? Oh yeah, it was a blast. So anyway, the hospital visit was for the most part very crappy. The best thing about it was that my friend N came to visit me. And when he came, he took really good care of me. He was like a nurse to me, basically. He, helped me take my first post-op steps. He fed me, he spoon fed me. I didn't even have to lift my arms to feed myself. He kept me entertained. He told interesting and funny stories to keep my mind off of how crappy it was to be in hospital. And he was very affectionate and kind. He did everything for me except wipe my ass. Oh, I guess it's kind of TMI, huh? Nevertheless, he was really good to me, and that made the hospital stay infinitely better. So, once I could pee, and once they found a good medication to manage my pain, a medication that ended up being Percocet, I was able to go to my mom's house to recover. Now, for the first few days, my mom was, she was, nice to me. She brought me food to my room and stuff like that, and did little chores for me or whatever, laundry. But after a while, once I was able to be a little bit more mobile, she stopped being as nice to me as she was in the beginning. She didn't really support my decision to have top surgery at all. She thought it was very extreme and a bad idea. So I guess those feelings of her thinking it was a bad idea came back, and she stopped doing stuff for me. And when I would mention my surgery or the pain I was in, she would change the subject. What a sweetheart, right? Also, not long after surgery, she started talking to me about when I'm going to move out. And it's like, thanks, Mom. I just got my chest reconstructed and you can't wait to get rid of me. Okay, so she isn't, the best mother of the century, but she's a less horrible mom than Joan Crawford's crazy ass. So that's my only consolation, really. Anyway, let's move on. The first month. The first month of my recovery, I had a lot of pain. Not just like physical pain, oh my gosh, my body's been reconstructed pain, but also pain because the nerves were regenerating. And that was so awesome. Oh, yeah, I'm being facetious right now. I had full sensation in my chest from the get go, which is great because some people lose sensation for weeks, months, or even years. But the downside of that was I would be experiencing lots and lots of nerve pain as things were reconnecting. So, even though it was great to feel stuff, I wasn't really happy about it because I was feeling pain from the nerves. Also, it was hard for me to walk around for the first month because not only did I have those two drains connected to my chest that people talk about, I also had this machine stuck to my nipple that had problems, the left nipple. Now, this machine was heavy and it was loud, so walking around was difficult and sleeping was really hard because it was so noisy, at night. It was hard for me to fall asleep. So for the first week, I didn't get a really good amount of sleep, and I don't know, I think I was a little loopy and goofy for the first week. I mean, if you look back to my 6 days post-op video or whatever it's called, I was a little like happy and loopy acting. But anyway, for 7 excruciating days, I had that stupid machine stuck to me, and then it was finally removed. But I still have the drains to deal with. Drains and changing bandages. The drains were a real pain in the ass. It was hard to shower with them, and I had to empty them several times a day and make a record of how many milliliters of blood came out, and it was just freaking disgusting and annoying. And I had to have those drains stuck to my body for a month, which, other people, they don't have the drain stuck on for that long. But because I had complications and because they wanted to make sure that I was going to be all right, they left the freaking drains on for 4 weeks. You know how difficult it is to just have a regular ass life with these two drains stuck to your chest? It was really difficult. But eventually they got taken off. And that was a load of fun because it was painful getting those things off of my chest. The kind of pain that I have a hard time describing. It was kind of like an alien was being removed from my chest, basically. And it was really, 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 really painful. And the part where the drains were connected to my chest left scars that have not gone away. Very deep, dark scars. They haven't gone anywhere. So, even after the drains were taken off and all that, I still had to deal with changing bandages. And during the first month, the pokey part of my nipples, pokey part. Yeah, the pokey part. I can't think of any other word. The pokey part of my nipples fell off. Yeah. So I'm a person who just has flat nipples without any pokiness. You know, the pokies are gone. That was something I wasn't expecting. That was something nobody was expecting, but it happened, and I couldn't just get them glued back on. So I'm just gonna be pokyless for life. Just flat nipple things. It's kind of weird, but I have no choice but to live with it. Anyway, let me move on. The past 11 months of my top surgery recovery have been emotionally and physically challenging. No, even though there was the Percocet, it didn't help the nerve pain, and the medication given to me for the nerve pain didn't work at all whatsoever. I'm also not really happy with how deep my scars are and how it might take 10, 20, who knows how many years for them to finally fade. That bothers me. As far as the psychological part is concerned, well, I did mention in a video last year about having phantom boob syndrome, so there was that issue. And also, I had more controversial thoughts and feelings coming up. I not only did I feel like I was amputated, but I also felt like I was mourning the loss of two parts of my body that had been attached to me for 22 years. So it was kind of sad and scary to go from 2 decades of having boobs to suddenly having no boobs after 6 hours, in a matter of 6 hours. So it was a shock, to the system. And, it didn't really cause me instant happiness, you know? And that's one thing that I want to bring across to people that you may have surgery, but it may not be the thing that causes you to have joy right away. And that's something I'm going to talk more about in my next video because this video is getting really long. So stay tuned for part 2 of my post-op story. Bye.